Is it going?
Yes.
We have one shot at this. Don't screw it up. Hi, I'm Brady Barrington. I'm a nurse practitioner student at University of Gonzaga. I was asked today to speak about my philosophy of nursing and my philosophy in healthcare. Currently, I'm an ER nurse for the VA. Before this, I worked in neurosurgery at University of Utah. I've been a nurse now for over 8 years, and it's been a very great, rewarding career for me. First off, my philosophy of nursing. I think the biggest thing that nurses can do is be a patient advocate. This is why I got into nursing. I had family that had some health struggles, and I saw firsthand what an advocate can do for a patient. And as I got more involved in nursing over the years, I've become a bigger and bigger patient advocate. I believe advocates improve communication, and they truly look over the patient holistically, make sure all of their needs are taken care of, as well as the needs of their family. Another one of my philosophies of nursing is embracing education and striving for as much as you can do communication or in education. So I'm currently doing that by getting my master's in nursing. I think nurses are lifelong learners, and so even after this, I'm sure that I'll go on, whether I get a DNP or I go back to school and learn Spanish. I will always be a lifelong learner, and I think it will help me in my career and help me be a better FMP. Thirdly, I think compassion is huge in the nursing field. We all need to be very compassionate nurses, and I think being a compassionate nurse helps me provide better care for my patients. This goes back to being a patient advocate. I think we all need to treat patients like they're our family, and whenever I'm taking care of a patient, it's kind of the thing that I've taught all of my students is treat them like they are your family. Make sure that they're fed, make sure that all of their needs are communicated to the providers, and if you do that, you're going to have a happy patient and they're going to take better care. Next, I need to talk about my philosophy of healthcare. I think our current system's disgusting. That we have roughly 40 million people who are uninsured in the United States. It's an atrocity. I think our system is reactive instead of proactive. Instead of treating the root cause of the diseases, we're throwing band-aids on it. That's kind of cliche, but that's exactly what we're doing. We let the pharmaceutical industry kind of control everything. All these for-profit hospitals that are making upwards of 20 to 30% in profits sometimes. With the insurance as the middleman, I think that we can do a lot better than that. I think other countries are doing better than that. This is one reason why I'm going to FMP school, so that I can make a bigger difference in my own community. Things that we can do to fix the healthcare system. I think number one, we need to deal with people's diets. We can do things like create universal electronic health records, so that providers can speak to each other across hospitals and clinics. That would cut down on unneeded or unwanted imaging, and it would cut down on med reconciliations. Improving communication is always pivotal in healthcare. Next, we just need to be more proactive, as I was discussing earlier, and we need to fix patients' diets. We need to have them get more physical activity. We need to have them drink less alcohol. We can do these things by educating our patients. We can also we can educate our patients in these areas, but we need more time to do this. And I think this is another area where FNPs come in, where we might be able to have more time. And hopefully in my career I can set up my own practice where I can take more time with my patients and really fix the root cause. Another issue is mental health. We need to put a stronger focus on mental health. And I think fixing that, as well as diet, activity levels, I think can make a big difference for a lot of people. I think it can make a big difference for my daughter Janice over here.
No, Dad, it's Berkeley.
Whatever, Janice. All right. Those are my thoughts and philosophies on healthcare. It's been a good night. It's been a good year. Thank you for listening, and I wish all of you the best of luck in your master's program. Thanks, Janice.